Hello, I'm David Charles, Chairman of the Alliance for Patient Access. We're an organization of physicians advocating for our patients' access to approved medical therapies. For years, cancer patients' care has remained protected. A general consensus, the gravity of being diagnosed with cancer, having a life-threatening illness, justified using every resource available: surgery, chemotherapy, and radiation, whatever the cost. Insurers knew to provide coverage for whatever was needed. But in recent years, a new trend has emerged. Insurers have begun imposing specialty tiers, prior authorization requirements, and unequal coverage for certain types of cancer treatments. Now, some patients are forced to make life and death decisions based on what they can pay out of pocket. These tactics may save insurers money, but they undermine the access and the quality of care that cancer patients need at the most vulnerable time of their life. Insurers use a tier system to categorize prescription medications and to determine how much patients pay for them out of pocket. Lower tiers include generic medications and usually require a modest copay, a flat dollar amount. But the highest tier, known as the specialty tier, includes more expensive medications such as cancer therapies. To offset the cost of these medications, insurers may require a coinsurance payment, an out-of-pocket payment for the patient, which is a percentage of the medication's cost. Now consider this. Some cancer therapies can cost between $40,000 and $100,000 a year. Coinsurance out-of-pocket can be 25% or 30% of that cost, sometimes more. This means that some patients are having to pay $10,000 to $30,000 per year out of pocket to receive the medication needed to treat their cancer, or go without treatment. Insurers' use of specialty tiers therefore means that some cancer patients are priced out of the care they need. There's more. Another challenge cancer patients face is prior authorization requirements. With prior authorization, patients must wait for the insurer's approval before receiving the cancer treatment the doctor ordered. For cancer patients, time is a valuable commodity. If you were diagnosed with a form of cancer, would you want to wait on someone at the insurance company to approve what your doctor prescribed? Some states are working to address this challenge. Several have now passed laws to limit this abusive practice by insurers. Making matters worse, cancer patients are now suffering from lack of coverage parity. Take chemotherapy, for example. For many years, most chemotherapy was given as an intravenous infusion. Fortunately today, some newer cancer therapies are tablets taken by mouth. Many insurance companies are trying to cover these therapies very differently, and this can cause huge discrepancies in out-of-pocket costs to many patients. In many states, insurers cover intravenous infusions under the medical benefit, but they cover oral chemotherapy differently, placing it in the prescription drug benefit. Purchasing chemotherapy pills under a drug benefit classified as a specialty tier isn't financially feasible for many patients. So this brings us right back to the beginning. Insurance companies trying to prevent cancer patients from receiving care by making the out-of-pocket costs so high they cannot afford the treatment they so desperately need. There are three critical challenges cancer patients are facing today. First, they should not be priced out of care due to exorbitant out-of-pocket payments for specialty tier medications. Cancer patients deserve more transparency and better access to life-saving treatments. Insurers should communicate their cost-sharing policies in straightforward, easily accessible language. Second, physicians and patients need a simple process for prior authorizations and a rapid response from insurers so that patients don't experience delays that interfere with life-saving treatment. And finally, parity should exist among cancer treatment forms so that patients and physicians have clear and fair choices about which treatments work best for individual patients.